A beautiful sunny morning. And it's a great day to welcome into the studio this morning one of the latest docs to come to IRMC. Dr. Jonathan Shafer is with us, operating out of the clinic in Seward. Our visit this morning presented by Marcus and Mack, voted best law firm and best personal injury lawyer 3 years in a row, and the best of Indiana County contest. You can visit them online at marcusandmack.com. Good to welcome you into the studio. How are you?
Yeah, I'm doing well. Thank you for having me.
Terrific. You're a Greensburg boy, huh?
Yeah, born and raised in Greensburg.
Yeah.
Graduated from Hempfield Area High School.
Yeah, so you know the territory.
Yeah, so grew up about an hour west of here.
Yeah. Where'd you go to school?
I went to St. Vincent College in Latrobe for my undergrad, and then I moved on to get my medical degree at Lake Erie College of Osteopathic Medicine in Greensburg.
It always fascinates me, the journey that doctors in particular have to take in order to get to wherever it is that they're going to end up, and understanding that there's a lot of movement within your industry, and so there are a lot of opportunities. What brought you to IRMC?
Yeah, I did my training at Conemaugh in Johnstown, so it was nice and close. I saw a small rural hospital that had many opportunities for me to grow as a physician and really take care of this community.
Coming to Seward and the clinic there, and you talk about rural. That's what Indiana County is all about. Seward across the line in Westmoreland County, but it's the same concept. A lot of folks from Indiana County probably visit you there from the Armagh, East Wheatfield Township, the Clyde area. And then you've got the New Florence folks, the Bolivar folks, and they're all coming there. I don't guess that it's any different from any other clinical setting, but it's an interesting dynamic, isn't it, to meet folks in those neighborhoods?
Yeah, especially Seward being in a central location between Johnstown, Indiana, and Ligonier. We get patients from many different populations, which makes our days very exciting and different than other clinics.
And you get to work with Dr. Eccles.
Yes. Yeah, Dr. Eccles, he actually trained me for 2 years when I was a medical resident at Conemaugh, so it's made the transition very smooth. I've known his staff and his patients for about 4 years now.
Is primary care something that you've always been geared toward? Do you have some other ambitions, or are you really very interested in that primary care role?
Yeah, I like being a general practitioner. I think my story in primary care is similar to others where I had so many interests during medical school. I wanted to keep things a wide scope of practice, and I do enjoy seeing many different things daily in the clinic.
We have heard from state medical officials that primary care physicians are really at a premium, that finding folks to settle into a primary care career is extremely important because you're really the very first line that folks meet when they have a medical issue or when they want to establish themselves with a medical practitioner. You know, I'm going to the doctors today, and you know, I'm going for my checkup today. You're the guy.
Yeah, it's extremely important to have primary care providers in the community because it's the central portion of a patient's care. We can screen them for conditions that could cause serious problems down the road, but may very well be treatable at this time. And we can coordinate care with all of the specialists that the patient has on board.
Establishing those baselines is extremely important, isn't it?
That's right. Yeah, it's important to see your primary care doctor at least once a year to keep all your preventative care in line, to keep you healthy and living a good quality life.
Now, coming into the setting in which you do in Seward, like a lot of communities around our area, there are a lot of folks who are older, who have a number of different conditions that they've been dealing with for a while. And a lot of them are already set up with specialists who are handling some of their great concerns. But primary care is really an important part of their entire formula.
Yes, that's right. We do encourage the patients to keep seeing their specialist as they recommend. However, following up with your primary care doctor can encourage you and identify if those problems aren't well controlled and maybe you need to see your specialist a little sooner than you expected.
The annual wellness visit that folks need to be taking, I know they're easy to neglect, and people do, but they're so very important for folks. Tell me about what happens at a wellness visit.
Yeah, so the annual wellness visit, you'll get a comprehensive physical exam to identify any unknown problems. You'll go over how you're doing on your medications and take care of any preventative healthcare screenings such as colon cancer screening, breast cancer screening, lung cancer screening, and et cetera. So it's very important to see them once a year and see us, and we'll take care of all that for you and keep you healthy.
Got to be a little bit of a detective too, don't you?
That's right. Yes. And it's the unknowns that we look for, and most times that's not the case, but if we catch things early, they're typically treatable.
How you feeling? Fine.
Yeah, yes. We do get that a lot. But
Yeah, but it takes a little conversation time with them, an exam here, check out something there, and maybe get them to open up a little bit about how they are really feeling, because we have that automatic response, don't we?
Yeah, that's exactly right. So as soon as you start asking a little more and deeper questions, things aren't fine most of the times.
Not as fine as maybe they thought.
Yeah, that's right.
For a lot of us as well, and, to be very frank, in this area, that's why we have the WalkWorks program, is that there are some folks who are carrying a little bit too much weight, and because of that, programs get instituted, such as the WalkWorks, to get people moving and exercising. It really is important, isn't it, to keep yourself moving and engaged?
Yes, exercise is one of the best things that you can do for your health, and it really has no drawbacks to it. So keeping a healthy weight and keep moving daily improves your entire general health.
Yeah, and probably one of the things that you would, and I don't want to put words in your mouth, but one of the things that you deal with a lot is conditions that either have led or do lead to diabetic concerns.
Yes, that's right. So if we can make alternations to a patient's diet or increase their exercise, and we can screen patients for diabetes or prediabetes and really prevent it from developing or getting worse in the future with some lifestyle changes.
Yeah, and keeping a monitor on those sorts of things through a wellness visit is a really important thing.
Yes, that's absolutely right.
What are some of the other reasons that folks might want to visit you in Seward?
So we offer same day or next day sick visits. So if you're feeling unwell, our patients can get in pretty easily, and we can take care of that for them. We have lab capabilities at the Seward office. So if you're due for your yearly blood work or monitoring your chronic conditions, we can get you lab work performed. We have x-ray capabilities in the office. So if you fall, injure yourself, concerned that you have a broken bone, come on in and we can get x-ray done of that area and see what's going on.
Yeah, so all of those things are great reasons to visit and get established with the primary care. That's really important for folks.
Yes.
Since the pandemic, I don't know that as many people are visiting the doctor as should be, and probably not. But I don't know as well whether as many people are visiting as previously did. Maybe they didn't get back to going to the doctor on a regular basis. It's time to start that.
Yeah, I think you're absolutely right. We did see a drop in patients during the pandemic, but that's resolving itself, and we're seeing patients more frequently visit their primary care doctor these days, a couple years after the start of the pandemic.
Dr. Jonathan Shafer is with us from IRMC, but specifically working at the primary care clinic in Seward. That relationship with IRMC is extremely important, because that opens you up, opens a patient up to all of the great resources available at IRMC. And frankly, to find a hospital in the setting such as we do here in Indiana County that is able to offer what this one can is an amazing thing.
Yes, so that's one of the reasons that drove me to IRMC. You look at it as a small, independent rural hospital that's not owned by a big healthcare giant. And more rare is that the hospital is thriving in the community. So I'm thankful to be a part of this community, and there are countless resources available for patients in this area that they don't have to travel to Pittsburgh or other big cities for.
Yeah, the scope of services is pretty amazing for a hospital in the setting in which we find ourselves here in Indiana County. We might be rural, but we're big city too when it comes right down to it.
Yeah, that's right.
So the clinic in Seward and the resources of IRMC at your disposal, working with Dr. Eccles, it's pretty good setup you got going there.
Yes, yeah, I'm extremely thankful and really couldn't ask for much more, being able to practice in a rural setting with so many resources around me for my patients.
Yeah, so there you go, you folks in Seward, New Florence, Bolivar, Clyde, Armagh, that entire Vintondale. The clinic is there for you. If folks want to make an appointment, what do they need to do?
They can call the office at 814-446-5695.
Beautiful, beautiful. Dr. Shafer, good to meet you.
Yeah, nice meeting you. Thank you for having me.
I'm glad you came in to visit with us here today. The PCP services available with Dr. Shafer, Dr. Eccles, and Seward, really, really important for our region. It's Indiana in the Morning on WCCS, 101.1 FM, AM 1160, and WCCSradio.com. Speaking of docs from IRMC, tomorrow here on Indiana in the Morning, Dr. Dan Clark will be visiting us to talk about breast cancer. And so that's another very, very important service. It's 23 minutes after 8. It's Indiana in